Hello, everyone. My name is Conteh from the Sierra Leone Urban Research Center. We work with the Arise Consortium, which is funded by GCRF. And so I'm going to do a presentation, which is actually trying to understand how politics is, organized within the informal settlements in Freetown and how that impacts on health and inequality. So the topic of my presentation is navigating the politics of health in informal settlements in Freetown, Sierra Leone. The next slide is actually photos of community representatives of people we work with within these informal settlements. We call them the co-researchers. And so these are a group of community representatives living and working in these settlements who have volunteered to work with the Arise project to understand how we do research and use the research for uptake and advocacy. So first of all, I'll talk about how the governance system is organized within the informal settlements. So we can talk about it in two ways. One is a formal and the other is an informal. So the formal governance system, talks about agencies within government and departments that provide services. And they also include elected representatives like the members of parliament, councillors, and then they also include local service providers like the healthcare workers and, people providing other forms of services like water. And the informal service providers include community chiefs, chairmen and ladies, youth, women's organizations, social clubs, and different groups within those settings. Now, the reason why we like to call them informal is that in many cases these actors only emerge to address specific leadership gaps or service provision needs within this settlement. So, in some cases they are not really recognized by governments. So they just emerge to provide services or specific needs within those settlements. So in terms of the roles, we can look at it also from both sides, the formal and the informal. So from the formal point of view, formal actors provide services like water and healthcare services, and then they also try to enforce laws that are already made, which informal settlements, residents and other urban actors and residents are supposed to abide by. And then there's also political representation of these settlements and the entire urban spaces through political elections or electoral system. Development of roads, health, education, and water infrastructures to provide services. And on the other side, the informal service providers include, their roles include providing services and, making and enforcing bylaws. So they don't make laws, but then they just make specific bylaws that are supposed to, that community residents are supposed to respond to or abide by. And then there's also leadership representation, community engagement and advocacy to, enhance the provision of services and meeting the basic or certain specific needs of people living within these informal settlements. So in terms of power dynamics, it's very, very much complex. Complex in the sense that, like I said earlier, the governance arrangement is sometimes divided into formal and informal. So sometimes there are situations where the formal and informal governance actors, their roles overlap. And so there's tension around who provides what and who does what. And so this is also a challenge because even in the legal instruments, like we have the Constitution of Sierra Leone, and then we also have the Local Government Act of Sierra Leone, there are, a lot of confusion, about what the law provides about who does what and what. So for example, the Constitution provides that members of parliament are mainly responsible for, oversight and making laws and having engagements with their communities or their constituencies. Whereas the Local Government Act provides that the councillors are the representatives of local local communities. So in that sense, they are the ones who are responsible for local development. But then when it comes to actual expectations of communities in terms of development, they expect both the councillors and the members of parliament to provide development functions. So when that is not done, then members of parliament are expected to either step down or maybe more is expected from them. So these kinds of confusion in even the law creates a lot of tension about service provision. And then there are also contested boundaries in terms of what or where each elected member is supposed to cover. So for example, within the localities of the local councils, the councillors are the ones who are supposed to be in control. But then because the localities are smaller than the constituencies, members of parliament sometimes feel that they should also control the wider space, which includes the localities. And so because of that, there's a lot of tension. And these tensions sometimes arise as a result of political ambitions, whereas councillors are serving at a lower level and will want to serve, contest the position of MP in the future. So they see themselves as contestants, and then there's so much tension within those communities. And so also political party influence is also very much something that influences development at local level. So within Freetown, we have the ruling party, which does not have Freetown as as a stronghold. So currently, the opposition party is the one that has a stronghold of Freetown. So because of that, contestations around who controls development programs, who is in control of the city, brings a lot of challenges. And this one also impacts on service delivery and accountability, even in informal settlements. And also another challenge is that, within the informal settlements, there's no blueprint about who government recognizes to work with or not. So sometimes government decides to work with certain actors because of certain development needs or because of certain priorities. So it's a challenge about who controls what. And so also because of all these challenges and how this has impacted on development over time, we at Arise have tried to create a space so that we can share learnings and and knowledge about how we can try to improve services within informal settlements and relationships between urban actors and people living in informal settlements. So one of the things we did was to recruit volunteers whom we call co-researchers through the community-based participatory research scheme, which we call the CBPR. So we have worked with them in data collection and analysis jointly. We have worked with them in GIS mapping so that they can identify, the spatial boundaries and where challenges are in terms of service delivery. And then we also worked with them. We created a relationship between them and, the COVID-19 response team, the DCOVAC, to be able to adapt messages for people living in informal settlements. And then they also carried out vaccination campaigns to increase uptake of vaccines. And then another importance of these spaces we've created with, the informal settlement actors is that we have had a number of reflexivity sessions where we reflect on the power dynamics between researchers, and co-researchers, so that we're able to understand how this space exists and how we can be able to navigate, the barriers to understanding ourselves and then working together. So it has been very great working with co-researchers, and this has contributed in increasing their capacities in terms of analyzing their health and well-being priorities. Another important achievement of the Arise CBPR process is that it has given voice to the urban marginalized residents to advocate for change, and then it has also helped to increase some form of understanding between them and urban actors like the city council, and the body that was responsible for responding to COVID-19. So through these kinds of relationships, we have also acted by helping to provide relief items for people living with disabilities, and other forms of other categories of people who are extremely vulnerable within these informal settlements. And so we are very happy that these kinds of collaborations have helped to improve understandings, and we hope that we can be able to increase the relationships between urban actors and people living in informal settlements through these kinds of relationships. Thank you very much.